All right, let's dive into today's top health and tech stories. I love connecting those dots, seeing those unexpected links.
Absolutely. There's always something to uncover. Let's see what today's headlines have in store.
First up, measles in West Texas. 7 unvaccinated people hospitalized, raising concerns about a potential wider spread.
And this news comes at a pretty interesting time, wouldn't you say? Congress is considering RFK Jr. for HHS secretary, a known vaccine skeptic.
The timing couldn't be more pointed. It's like this outbreak adds fuel to an already heated debate.
Exactly. What kind of impact could this have on national vaccination policies, especially if RFK Jr. actually gets the position?
That's the big question, isn't it? Now, switching gears to the tech world, AI is making some serious moves in healthcare.
Oh, absolutely.
Yeah.
Lots of health systems are adopting it rapidly for all sorts of things, from documentation to detecting cancer.
It's not just streamlining tasks, though. There's a study suggesting AI could potentially replace heart catheterization.
Wow. You're talking about a procedure considered the gold standard in cardiology.
That's right. AI making decisions about invasive procedures. That's a huge leap.
It really raises all sorts of questions about what this means for cardiologists, for patient care, even ethical considerations.
I mean, how comfortable would you be with AI guiding a major healthcare decision like that?
That's a question we all need to think about, especially as AI becomes more and more integrated into healthcare.
Speaking of challenges, let's look at what's happening in Massachusetts hospitals. They are facing financial strain, leading to closures and layoffs.
It's a stark contrast to Banner Health. They've managed to significantly reduce patient length of stay, saving money without compromising on quality.
So we've got one system struggling, another thriving. Is there a secret to this, or is it just circumstances?
Well, Banner Health's approach is all about efficiency and streamlined care.
Makes you wonder if those strategies could be applied elsewhere to help hospitals struggling financially.
Right. It's definitely worth exploring. Now, let's take a look at the business side of healthcare. Bristol Myers Squibb announced a $2 billion cost reduction plan. They're dealing with patent expirations on some key drugs.
That's a familiar story for those big pharma companies.
Yeah.
But there's another story that paints a different picture. Independent ASCs are getting a lot of funding, suggesting investors are confident in that sector.
So 2 contrasting trends in healthcare investment.
Yeah, what does that tell us about the future of healthcare? Where's the money going?
Maybe it points to a shift in focus towards more localized, specialized care. The success of ASCs could be a sign of that.
Fascinating, right? These contrasting trends.
Yeah.
But we can't forget about the human side of all this. You know what I mean?
Of course, we can't lose sight of the people at the heart of it all.
Speaking of which, we have this amazing account from an Australian midwife, Gabby Rozelle, sharing a day in her life.
It's a great reminder that healthcare is more than just data and policies.
These personal stories, they're so important. They ground us, you know?
Absolutely. Gabby's story takes us beyond those clinical charts, shows us the real-life drama of delivering babies, the ups and downs.
I'm already hooked. What does Gabby's day reveal about the human side of healthcare?
Well, it shows the emotional roller coaster of being a midwife, the deep compassion it takes, those unexpected moments that make every day different.
It sounds as a must-read. But before we get to Gabby's story, let's take stock of what we've uncovered so far.
Right, we've seen potential shifts in healthcare leadership with this RFK Jr. situation, AI looming large in cardiology, hospitals facing financial struggles.
And yet there's also a sense of optimism, isn't there? With Banner Health doing so well, the rise of independent ASCs, it reminds us that innovation, adaptation, that's how we navigate healthcare's complexities.
I didn't agree more. And as we explore these bigger trends, let's keep those individual stories in mind, those stories like Gabby's, reminding us why healthcare matters so much.
Well said.
Yeah.
Now, let's take a closer look at Gabby's day. What insights can we gain from her experiences? Stay tuned. Gabby's story, it really hits home, doesn't it? The dedication and resilience of these healthcare professionals.
It does. It's easy to get lost in the big picture sometimes, but it's individuals like Gabby who are out there every day making a real difference.
Absolutely. Her account, it really captures what it means to be a midwife. That commitment to mothers and babies, navigating those intense emotions, the impact they have on families.
It's a must-read for anyone who wants to understand the heart of healthcare. Now, let's switch gears a bit and talk about Medicare's financial stability, something that always seems to be surrounded by anxiety.
Oh, yeah. There's always talk about Medicare going bankrupt, but we have an article here from KFF Health News that addresses this directly.
And it argues that those claims of imminent bankruptcy, they're misleading. While Medicare does have funding challenges, it's not about to collapse.
That's reassuring to hear.
Yeah.
So what's the real story then? What's causing these funding challenges?
Well, the article explains that Medicare's hospital insurance program, Part A, that's the one facing long-term pressure. It's because of rising healthcare costs and the aging population. More people are drawing from the system, and the costs keep going up.
It's a double whammy, for sure.
Hmm.
So is it just a matter of time before Medicare runs out of money? Or are there solutions?
The article's pretty clear that Medicare isn't on the verge of collapse. It's more about long-term sustainability, and it does outline some potential solutions.
Okay, I'm all ears. What are they talking about?
Things like adjusting eligibility ages, increasing payroll taxes, even reforming how healthcare is delivered to control costs. It's a complex issue, so it'll probably need a multifaceted approach.
No easy fixes, sounds like.
Yeah.
But at least there's a conversation happening. Now let's move on to another big healthcare initiative, the Affordable Care Act. We have some new data on enrollment numbers.
And they're looking good. Enrollment through the ACA marketplaces is at an all-time high. Over 24 million people have signed up.
Wow, that's impressive. So the ACA is thriving, even with all the political debates and attempts to repeal it. What does this tell us about healthcare access in the country?
It shows there's still a huge need for affordable healthcare options. The ACA is clearly filling that gap, giving millions of Americans a safety net they might not have otherwise.
It reminds us that healthcare isn't just about procedures and technology. It's about access, equity, ensuring everyone has a chance to be healthy.
Exactly. And speaking of access, we should touch on President Trump's recent executive actions on global health.
Oh, right. I remember seeing those headlines. What exactly has he done?
We have a resource from KFF that gives a really good overview. It details executive orders and other measures taken since January 2025, covering a wide range of global health issues.
So it's not just a couple of isolated actions then. What are some of the main areas he's focused on?
Things like pandemic preparedness, HIV/AIDS, maternal and child health. It really lays out the administration's global health priorities.
So it's not just domestic healthcare, it's engaging with health challenges on a global scale. Makes sense. But what are the implications of all this? Is it all positive, or are there concerns too?
Well, the resource acknowledges both the potential positive and negative outcomes. It's not a black and white situation, more like a nuanced assessment of what impact these actions might have.
Sounds like a valuable resource for anyone who wants to understand global health policy.
Yeah.
Now, let's circle back to where we started, that measles outbreak in West Texas. It brings up those questions about vaccine hesitancy and the potential consequences.
Absolutely. It's a stark reminder of how important vaccination is for public health.
And it's become so intertwined with the whole RFK Jr. situation, hasn't it? It really highlights how leadership can impact public health policies.
For sure. The choices made by those in power, they can have huge consequences for entire communities.
This deep dive has taken us all over the place, from a midwife in Australia to the financial health of Medicare, even the global impact of U.S. healthcare policies.
We've covered a lot of ground, but it's all connected, forming this intricate picture of healthcare today.
And while we've talked about some challenges, it's encouraging to see stories of innovation and progress, Banner Health success, those ASCs, and dedicated individuals like Gabby Roselle. It gives us hope.
Definitely. It's a reminder that healthcare is always evolving, always adapting, always pushing for better outcomes.
Well said. Now, before we wrap up, there's one more story that really caught my eye. It's about a surprising link between a simple daily habit and a major health concern.
Intriguing. Tell me more.
Researchers have found that regular flossing could significantly lower the risk of stroke.
Wow, that's incredible. It's a perfect example of how small changes can have a big impact on our health.
Right. We don't always need complex treatments or expensive interventions.
Sometimes the simplest solutions are the most effective, especially when we're talking about preventative care.
And it connects nicely with that story about the new at-home treatment for liver cancer. We're seeing this trend towards more accessible, patient-centered care.
It's exciting, isn't it? It could really revolutionize how we approach healthcare. Imagine managing chronic conditions from home.
That would be game-changing. But as with any new technology, we have to think about the potential downsides, make sure everyone has access.
You're absolutely right. We can't create new disparities. We need these innovations to benefit everyone.
This brings us to a bigger question that's been running through our entire deep dive: the role of human healthcare providers in an age of increasing automation.
Right. We've seen how AI is being used for more and more tasks, even making complex medical decisions.
It makes you wonder, will AI ultimately empower or overshadow human healthcare providers? Will it enhance their work? or eventually replace them.
It's a question without easy answers. Some people worry about job displacement, a dehumanized healthcare experience.
I can see that. But others believe AI can free up healthcare professionals to focus on the human aspects of care, the empathy, the compassion, things machines can't do.
It's about finding that balance, right? Harnessing the power of technology without losing the human touch.
Exactly. The future of healthcare depends on how we integrate these advancements, how we leverage AI without sacrificing the human connection.
It's a challenge, but it's crucial to remember that healthcare is about people, their stories, their struggles, their triumphs.
Which brings us back to Gabby Rosal, the midwife.
Yeah.
Her story reminds us that behind every headline, every statistic, every technological breakthrough, there are real human lives being impacted.
Her story is a powerful reminder of the dedication and compassion that drives healthcare professionals all over the world.
It really is amazing, how something as simple as flossing can have such a big impact on our health.
It is, isn't it? Speaks volumes about preventative care, taking those small steps to protect ourselves.
Absolutely. And it ties in with that at-home treatment for liver cancer we were talking about earlier.
Right. This trend toward more accessible healthcare, putting patients in control.
It's exciting to think about. Managing chronic conditions from home, making things easier and more comfortable.
Imagine that, right? No more running back and forth to the doctor for everything.
It would be revolutionary. But of course, with any new technology, we have to be cautious. We don't want to create new disparities, make sure everyone benefits.
Exactly. Access and equity, those have to be top priorities.
Which brings us to that bigger question we've been circling around all episode. The role of human healthcare providers in an increasingly automated world.
We've seen AI doing more and more, even making those big medical decisions.
It really begs the question, will AI empower or overshadow human providers in the long run?
It's a tough one. Some people are understandably worried about jobs, about healthcare becoming impersonal.
Yeah, I get that. But there's also the argument that AI can free up doctors and nurses to focus on the human side of things.
Yeah.
The empathy, the connection.
Exactly. The things machines can't replicate, no matter how advanced they get.
It's a balancing act, right? Harnessing the power of technology without losing that vital human element.
Absolutely. The future of healthcare hinges on how we integrate these advancements, how we use AI to improve things while keeping patients at the center.
And that brings us back full circle to Gabby Rosal, the midwife. Her story reminds us that there are real people behind all of this.
Every headline, every statistic, they represent human lives and experiences.
So as we wrap up this deep dive, we want to leave you with a challenge. Think about the human impact of healthcare decisions. Advocate for a system that values innovation and equity. And remember that technology should serve us, not the other way around.
Well said. Thank you for joining us on this journey through the world of healthcare. We hope it sparked your curiosity and inspired you to stay engaged.